Hi, this is Spencer Raub, and today I'm gonna be talking about my Ruop Triple I poster. Um, for my research project through Ruop, I focus on reconciling medicine with community values, oral histories of healthcare workers during the COVID-19 pandemic in Wenatchee, Washington. That's where I did my um, 1 month Ruop rotation, and was able to talk with a few of the healthcare workers there. So for the background of my project and of the area that I was working in Wenatchee, Wenatchee is kind of this bigger city almost, just past the Cascades, sort of centrally located in Washington at the confluence of the Wenatchee and Columbia rivers. And the demographics are about 72% white and 1% African American, 1.3% Native American, 0.8% Asian and Pacific Islander, and then 33% Hispanic and Latino. Um, and because Wenatchee is really known for being like the apple capital of the world, it has a lot of farming there. So they have a large population of migrant farm workers who live and work there for most of the year. And so the demographics there are kind of a unique situation, especially compared to the surrounding areas of Wenatchee. So the main industries in Wenatchee are healthcare, number one. I think the majority of the population in Wenatchee, aside from working in agriculture, works for the healthcare system. I believe the healthcare system there, Confluence Health specifically, is the number one employer in the Wenatchee area. So they rely heavily on their healthcare system, as well as their farming and tourism, um, especially being located close to Leavenworth and kind of being centrally located. Wenatchee's a good place to visit in the summer when I was there. Um, and they have hydroelectric power. They have a big dam there, so that's a main industry for them as well. Um, so for the methods of my project, I worked at Confluence Health and was able to kind of personally reach out to a couple of the MDs that I'd worked with, as well as an RN and a clinic manager, and kind of did these 30 to 45-minute in-person interviews um, through audio recording to kind of get their perspective, take an oral history from them, and get their perspective on the COVID-19 pandemic and their thoughts within their community, and how they kind of reconcile their views with the community's views. And so as I conducted these interviews, I kind of learned to be more flexible in my interviewing, having, maybe a few scripted questions, but being more flexible and kind of letting them lead, I think was more of the idea of getting these oral histories and what they wanted to talk about. And so then these interviews would end up being stored by the National Humanities Center at Duke. So for the results, the themes that I kind of parsed out from my interviewing these healthcare workers was there's kind of, especially in Wenatchee, it's kind of 50-50, pretty conservative and liberal. Um, and you get a lot of vaccine hesitancy among the general population. I put a graph down there at the bottom that kind of shows it's 50-50 really, fully vaccinated and not vaccinated. And because healthcare industry there is so big, I think that there's a lot of disappointment among a lot of the healthcare workers because even a lot of their colleagues, I think 33% of the um, nursing population in Wenatchee was unvaccinated. I mean, it was pretty high. I can't remember the exact number. And so that was one of the main themes was kind of this healthcare worker burnout, seeing their colleagues that they work with every day refusing to get vaccinated, even though they're seeing, a large, their ICUs are completely full, and seeing a large portion of their population dying from COVID. And so I think that kind of created a lot of burnout, was one of the main themes, as well as kind of a lack of trust by the community as well. So, because the community is 50-50 conservative liberal, there was a lot of kind of lack of trust within the healthcare community as well by the regular community. And so kind of a divide that wasn't really there before. They had kind of worked in harmony. Even though their community was kind of split along those political lines, there was a lot of harmony before the COVID-19 pandemic, but this kind of unmasked a lot of those issues. And so kind of one of the things that I concluded is kind of how do you reconcile the values of medicine and the values of the local community? And that was extremely hard, I think, for a lot of these healthcare workers that I had interviewed, and kind of feeling like they needed to be politically correct because they are serving this population, even though this population doesn't necessarily agree with their opinions as medical professionals. And so kind of being able to take these oral histories kind of allowed an avenue for them to, in a private space, kind of air their concerns and really what the fears were for the patients and the healthcare workers. And I think oral histories would be important in kind of reconciling those two thought processes. Thank you.